Persistent low back pain and exercise, part 2. If you haven't seen the part 1 video on starting exercise for persistent low back pain, it would be good to check this one out before watching the current video. This gives us some guidance about where to start with exercise for those with persistent low back pain. And this one now focuses on our next steps, where we're prescribing longer term exercise. Now, this video is aimed to really simplify things about how you might apply these principles in practice. To be effective in our management of persistent low back pain, we really need to understand persistent pain, what it is, how it develops, and the complex and individual interaction of factors that may be contributing to the pain experience of your patient. So let's look at our next steps in using exercise. Gradual re-exposure to potentially difficult tasks is being able to take a painful task and guide the patient how to gradually build up. It might include breaking tasks down into smaller components and encouraging more and more activity in a graduated way. It's also a bit more broad than that too. It involves ensuring the patient understands that flare-ups and setbacks are normal and okay, and it's about progressive, long-term thinking. Like our early stages of prescribing exercise for those with high levels of persistent pain, we want to focus on what our patient can do, so we need to have a really thorough picture of our patient and understand what is going to be important and meaningful for them. So let's cut to the chase and talk through some key principles from the literature which can help you start and progress exercise for persistent low back pain through this final stage. For those who are looking to exercise at home or independently in a gym environment, we can provide 4 to 5 easy exercises to start, or take their existing exercise and instruct them on the 4 or 5 you want them to focus on. Often the most helpful exercises are typically focused on large ranges of movement that challenge what the patient finds difficult. Let's look at the patient example from our last video. This patient had pain and associated threat with flexion and standing, especially under any load. In our initial exercise, we focused on breaking flexion down into smaller, more manageable components in a way that the patient perceived was safe, with a goal of building up their confidence. Longer term exercise for this patient is likely going to look quite different, as we are focusing on big movements that challenge them as they're improving. This might be using things like deadlifts, squats, bent over row, wood chop or reverse wood chop, just to name a few. Exercises that might challenge flexion and rotation. We might also encourage this patient to consider exercise in a more formal group setting, whatever the patient can enjoy and stick to in a long-term and sustainable way. Like exercise for anyone with any goals, exercise needs to be progressive. Not necessarily in the individual specific parameters, but moving exercise in a progressive way towards the patient's goals is the way to go, especially for persistent pain. So this might be building up the duration of exercise, tolerance to load, or even tolerance to movements or positions that are seen as threatening or the patient has a history of avoiding. This is the most important point. If you're working with someone with persistent low back pain where high levels of nervous system sensitivity is experienced, such as central sensitization, exercise with some pain is okay and to be expected. It might be helpful to use a visual analog scale of pain to guide the patient. Some discomfort with exercise is to be expected. Research has indicated that people exercising with pain have favorable outcomes, usually when they're in that 3 to 4 out of 10 level of pain, and when they don't exceed 5 out of 10 on a visual analog scale. We can also guide the patient that symptoms should subside prior to the next bout of activity or the next day. So what about dosage? Well, we've got a few options for dosage. We can use strength training parameters, and we have evidence to show programming at strength parameters of 60 to 70% of 1 RM, as assessed on a Borg scale, is effective for those with persistent low back pain. We need to be flexible though. Flare-ups are common and in many cases almost expected. We need to allow for setbacks, being okay with periods off, or ideally periods of modifying exercise if things go wayward for a while. Getting back on track is the main thing. So it's really helpful to remind patients of the progress they've made since they started. So measuring and recording progress and checking in regularly can be powerful for these reasons.